If you look at the healthcare landscape, there's a lot of problems. Right now, we've got the people over age 85 are expected to double by 2040. Meanwhile, we've got a nursing shortage as it stands, and that's expected to grow. Over half the nurses in the United States right now are over age 50 and likely to retire out of the system. New nurses who come in only practice for a couple of years before they go on to do something else. So we do have an issue here with not enough supply of providers to look after the growing population of people who need the most care.
Growing
Meanwhile,
demand.
we have an issue with medical error already today. It's the third leading cause of death. And so when you factor in that we
What do you
already
mean
have
by medical error? Is this problems with the instruments, problems with the diagnoses, problems with the physicians? What is medical error? Why is that so big?
It could come from a lot of places. For example, if you have an incorrect blood draw, something happens to your blood specimen on the way to the lab, and then therefore the resulting the diagnosis could be inaccurate. Over 70% of medical decisions come from lab results. But also, one of the biggest areas is pharmaceutical medication error. So meds are prescribed. Let's say one patient over age 65 has maybe they're on 12 different meds. They've got meds from their different physicians that they see. And the status quo is that the doctors aren't talking to one another to coordinate what the patient's on. So you could actually result in, this could lead to hospitalization and even death in some cases. Hence why medical error can be the third leading cause of death, is the third leading cause of death in the United States. So, and that problem, imagine what I just said about the aging population and not enough the supply of workforce to look after them. And we already have a problem with medical error. So that problem is probably going to grow. So all of this to say that this whole environment, this confluence of these issues is screaming for disruption and innovation. And it's happening. It's happening rapidly, and we're still in the very early days of it. So there's a long runway here.
Hey everyone, thanks so much for watching Investors Business Daily on YouTube. If you want to watch more videos, make sure you hit that subscribe button so you don't miss a thing.